Well, hey, what's up everybody? So today we're gonna do a little update on Valen, post-op surgery update. So yeah, 4 months, 20 weeks, you said, right? Okay.
Yep.
All right, so first, let's, here, we'll stop right here and we can chat a minute. First, give us an update on your progress now, 4 months after the surgery.
Like and subscribe. Right now, I finished physical therapy. I've done physical therapy at 19 weeks. I'm at 20 weeks now, so I've been about a week out of physical therapy. I am currently doing my own at-home PT twice a week. That usually is about 45 minutes of strength and agility exercises that I have been doing in PT. I just transitioned them to at-home work. And I'm also running 3 times a week. And by running, I'm in I think the 3rd phase of my run protocol for my surgeon. That consists of 5-minute warm-up at a walk, and then 3 times 3 minutes running, 2 minutes walking with a 5-minute cool down.
So what you doing today?
I am doing a run-walk interval. I'm doing 5-minute warm-up, 3 minutes running, 2 minutes walking, and I'm gonna do that 3 times.
3 times. And how you feeling?
I feel pretty good right now. A little tight, but we'll see how it goes.
Do you do any like other warm-up or just a walk? Anything else?
After the walk, I'll do some stretching.
Well, so what are you gonna do for your stretches?
I'm going to do hamstring stretch, quad stretch, hip flexor. That's pretty much all I do, really, in between.
And then you're gonna do 3 minutes run, 2 minutes walk?
Yeah. So after my second interval, my hip flexor started to get tight feeling, and I just kind of, usually when that happens, if I slowed back my pace a little bit more, it'll ease up, and so it did, and I was okay to finish the rest of them, and then stretching out after is really important. But you just gotta watch it, because sometimes I'll have that be tight and I'll need to stop, or sometimes you can just keep going, but you really have to pay attention to like how you're feeling to know if it's okay.
So overall, how are you feeling right now with the hip? Any pain, discomfort you're having still, or how's it going?
I would say overall on a daily basis, I'm feeling good. I'm feeling I'm not feeling pain. Sometimes when I sit for extended periods of time, I'll have a little bit of achiness in like the hip flexor area. Or if I have a really strenuous exercise day, I'll have a little bit of discomfort in the hip flexor area, and usually it's just a signal at this point that I need to stretch some more, I need to roll some more. Anything that you would be like if you were doing heavy training volume, like the aches and pains of like a heavy training volume, where you just got to take care of yourself. I feel like that's kind of where I'm at right now.
Yeah, so I've had a lot of questions actually through Instagram from a couple of people that are getting ready to have the surgery, and I've answered them as best I could, knowing what I know about Val, but we're going to put those questions now. We'll ask them and answer them right here, so hopefully other people out there that have those same questions can maybe get a little answer. Keep in mind, we're not doctors, we're not physical therapists. This is just what Valen has found through talking with her surgeon and her physical therapist and her own research that she's done. So with that said, let's get to it. So first, probably the biggest question that I've gotten asked a couple of times from different people is, knowing what you know now and what you've been through, would you still do the surgery?
I think so. That's probably not the question or the answer everybody wants to hear, but I think so. Before, I had impingement and pain, so I wasn't at some of the level people are as far as pain and debilitation, really, but I was getting there. By the time I got close to my surgery, I was able to run maybe a mile without pain, and that is nowhere near the training that I want. So with that said, I feel like I'm not 100% recovered, so I don't want to make a 100% statement that this is the right thing. But I'm feeling better, I'm feeling stronger, I feel like I'm going to get where I want to get. So mostly yes would be the answer. Well, I can say that my surgeon, when I talked to my surgeon about the surgery initially, I was asking him, whether I was going to be able to get back to my goals, and he said probably, but that if you don't have the structural impingement, surgery may not be the best option. Whereas with me, if I had not gotten the surgery and I just did strength training or physical therapy, I would still have the underlying problem, which was the hip impingement, which was causing the tear to begin with. That's not going to be fixed unless you do that with surgery. So that's what ultimately led to my decision to get the surgery.
And for those of you out there that might not know what a hip impingement is, essentially it's a deformity in the bone where there's like it's not a smooth rounded joint. There's a little piece sticking out like this that catches or causes problems. So that's what she had and what they had to eliminate through the hip impingement surgery. All right, flare-ups. That's a big question. People have asked because, you know, she's had a couple flare-ups. So tell us about, when I mean a flare-up, it's basically something that's causing her to maybe go back in regression in her recovery, or to stop where she's at and kind of slow down, take a pause. So let's talk about that for a minute.
Okay. Flare-ups is a pretty common term, like Steven said. It's just essentially things don't feel right. My first flare-up was at about 7 weeks, and then I had another one at about 18, 19 weeks.
I think it was like 17.
And I can tell you that in my paranoia, I was convinced that I had retorn my
She was convinced.
I was paranoid and freaking out. After which I talked to my surgeon, and he said, if you don't have any other problems that the surgeon didn't know about, like hip dysplasia or something other than that, it's really, really difficult to re-tear your labrum. So that's probably not what you did. The problem that people have with the flare-up is that because of the type of surgery and going in and messing with it, all of the structures and muscles and ligaments surrounding the hip joint are very confused, very inflamed, and you just got to baby them.
Takes a long time. It's a slow process.
When you have a flare-up, you've overdone something. You've caused inflammation in your hip flexor, or...
And that was her first one, was your hip flexor.
My first one was my hip flexor, and so the treatment for that was step back in intensity. I did some structural work, not structural, that's not the right word, some manual manipulation type work with my physical therapist, where they were just releasing the muscles and the tissue and
Hurts
stuff.
so good.
So that was my treatment for the first one, and then the second one was a pretty severe TFL flare-up, which is, I wrote it down, tensor fasciae latae. It's
Again, we're not doctors. So.
it's sort of in the back outside, close to the glute muscle. That had flared up. I was really, really, really worried about it at that time because it was causing like shooting pains, and I thought that I had torn something. So my surgeon said, and my PT said, take a complete week of rest. Don't just stretch, ice, rest. I do that with diet and
and you got
ice.
on the ice machine a lot more. She got on that more.
Ice machine more, and that did it. But keep mobile. When you're resting, don't be like just sit in one spot. That's not what they mean when they say rest. They mean intensity, reduce intensity.
Yeah, reduce intensity. Just like a taper for running. You got to reduce that intensity, but keep the volume, or maybe not as much volume, but reduce intensity for sure.
Yep. So I did that, and now I'm back.
Do you feel like you're still on track with your running goals? So if you're not familiar, she set a goal to run a half marathon by the end of the year after the surgery, right?
Yes.
And then next year you wanted to run a 50K.
Yes.
So do you still feel like you're on track for that and you'll be able to hit those? Obviously it's early, but what do you think?
I still think yes. I'm at 4 months, 12 months.
So did you mean like a calendar year, or did you mean by the end of this actual year? Like by the end of 2022?
I think I actually meant by the end of 2022. So that's
coming up a lot closer, because it's almost, so that'll be August, September, October, November, so 5 months.
So that's 5 months?
5 months.
From now?
From now, basically.
Maybe?
Yeah.
Maybe, that's a good question.
Mm-hmm.
I think so, but the thing that I'm learning the most is not to put a set time limit on when something's gonna happen. You just chill back and get through to the next step. I've always rushed through things.
Yeah.
It's kind of how I roll. But be okay with where you're at now, and then just focus on getting to the next step before you put too many specific goals, because everybody's different.
Yeah, it's all individual. So any takeaways, things that you've learned through your recovery that you think somebody else might benefit from as they recover through their surgery?
First, PT is important. If your PT says do things at home, do the things at home, and do them well. Take your time. Don't rush.
Focus on quality.
Quality, for sure, for sure. There's one thing that my TT did not specifically say to me, but other people did, and I took it and ran with it, was the, especially at the very beginning, lay on your stomach for like an hour a day. That's super, super helpful for your hip flexors.
Was it laying flat, or you kind of lay with your, almost like a, what do they call, is it a python pose in yoga?
You would start off by laying flat because it's too much stress on your hip flexors. But then you can graduate to getting like up on your elbows for a little bit of time. But anytime I feel like stiff, if I've been sitting a long time, I'll just kind of lay on my stomach for a while and just stretch that out. So that's important. Stretch as much as you can possibly stretch. Hip flexor stretch, hamstring stretch, quad stretch, glute, anything in that area that you can stretch, but don't overstretch. If it feel, just a slight, you're gonna want to feel a slight pull, not like deep stretch, especially at the very beginning. As you progress, I started rolling probably about foam rolling at about like 12 weeks, where you can really start getting into the area and sort of roll across.
Yeah, you'll know if it's too early.
glutes.
You'll feel
anything I'm telling you, ask your PT. If they're not telling you specifically, just ask them, and they will let you know if you should or shouldn't do something. Inflammation control, yeah. So most of your problems with flare-ups and aches and pains are going to be inflammation. So we're plant-based because we wanted to control inflammation in our body. We think that that's the best way to go for inflammation control. You make your own choices with that. Additional things for inflammation are ice, baby.
Ice, baby.
Ice lots, ice all the time. Anytime after I'm doing a run, after I'm doing PT, I'm icing. If I'm sitting on the couch and I have my ice machine, I'll do it then. And also I take a curcumin supplement, which is essentially, it's just turmeric.
And we drink a lot of turmeric tea too.
We drink turmeric. So those are super great for inflammation.
And we eat a lot of it in our food, actually. We use a lot of turmeric in our...
turmeric.
Yeah.
That's where it's at.
Yeah, it's good.
Do not work through pain. If you have pain, it is a red flag. Stop what you're doing. Take a break. Rest. Ice.
Try it the next day.
Take a break.
Yeah.
This isn't the time to push through aches and pains. If it doesn't feel right, it's not right. Don't do it.
Yeah, this isn't a 100-miler where you're at like mile 80 and you just need to toughen up and push through it. This is where you need to like back it off and maybe, DNF that day and try again the next day.
Yeah. Don't do it. Don't do it. Last but very not least is patience. It's the hardest part of this whole thing, is patience. Don't skip ahead. Don't skip. Do the work. In doing the work, a lot of that includes resting.
Resting is very important.
Yeah, rest
and recovery. All right, one other thing that people have asked is if she can bike. So she's not able to do like a road bike where you're getting that kind of lean forward position and you're in the drop or whatever and you're riding. She can't do that with the position because you said that it put too much pressure on the hip.
There's nothing that says that I can't do it personally at this point. I'm choosing not to because that position irritates the hip flexor.
So she's listening to her body.
So I'm choosing to only do upright bicycling, as in where the knee doesn't come.
Like those old school bike trainers, like where you sit upright like a grandma.
When I'm doing my bike training on the trainer, I'm just sitting upright. I'm not leaning forward because I just don't want to put that extra stress on my hip flexor. I know other people that have biked and do bike and do it well. I'm just choosing not to.
Listen to your body. All right, well that is gonna do it, I think. So I'm sure there'll be more questions from people out there, and if you do have more questions, drop them down below in the comments. I'll get Val to try to answer as many as she can. I'll try to answer as many as I can, because I've learned a bit through this as well, just by being with her. So thank you for watching. We appreciate you all. I hope this was helpful. If you have any other questions, like I said, let us know below. But if you haven't already, go back and take a look at the surgery video. I'll put it on the screen over in this area. You can take a look at that. And then on the other side will be a playlist of her whole surgery playlist, the Valen playlist. So thank you for watching. We appreciate you all. We'll see you on the next one. Remember, look at the camera too. Not there. Look here. Okay. Mosquito buzzing by my ear. It's buggy out here in Tennessee. Are you focusing on me?
No, it's focusing on me because I'm more important.
Thanks. We're not filming here. Appreciate you.